Okay, we have our client hooked up today on a 12 lead, and if you're looking at his placement of his electrodes, you'll notice there's only 10 leads, or 10 electrodes. But 10 electrodes transfers into 12 leads, and I'll show you how. We have the 4 limb leads, and that is your right arm, your right leg, and your left leg. So these are your 4 limb leads. In a standard Mason Liker, they would be placed on the shoulders and on the ankles. But because we're doing an exercise EKG, we want to have them closer into the midline of the body so it cancels out the artifact, so there's not as much shaking. If we were to have them on his legs and on his shoulders, there would be a lot of vibration from when he runs. So to cancel that out, we'll put them here. Now the right leg actually serves as the ground, and because of that, we don't really consider it as one of our main leads. We also have precordial leads, and there are 6 precordial, or also known as chest leads. These precordial leads take different views of the heart. The heart is centered around here, and it's angled this way in most individuals. V1, V2, V3, V4, V5, and V6 are all of our precordial leads that take different pictures of the heart. Alright, so we have our 6 chest leads, or 6 precordial leads, and then we have 3 from our limb leads, knowing that this one is the ground. Our 3 from our limb leads are AVR, which is augmented voltage right, which comes from the right arm, AVL, which is augmented voltage left, which comes from the left arm, and AVF, which is augmented voltage foot, which comes from our foot that is not the ground. Einthoven's triangle, though, also allows us 3 more leads to give us a total of 12. Those are lead 1, which is right arm and left arm, our lead 2, which is the right arm to left leg, and lead 3, which is the left arm to left leg. So we're getting a view this way, we're getting a view this way, and we're getting a view this way of the heart. So we have a total of 12 different views. Okay, so these 12 views allows us to see the 12 views that are presented here. If you look, here's lead 1, lead 2, lead 3, AVR, AVL, AVF, which is augmented voltage right, augmented voltage left, augmented voltage foot, and then V1, V2, V3, V4, V5, V6. Our precordial leads are here, and our limb leads are on this side. Now, also notice that, for example, in let's go with the precordial leads, V2 it's mostly negative, where in V4 it's mostly positive. Positive meaning it's above the baseline. V5 also mostly positive, above the baseline. So let's take a look at why V1, V2, and V3 are mostly below the baseline, V4, V5, and V6 are mostly above. Coming back to our client, we'll see that V1, V2, and V3 sit up here close to the top of where the heart is. V4, V5, V6 sit down towards the bottom of the heart. Now if we were to open Jake up, we would see that his atria are sitting about here and his ventricles are sitting about here. So what happens with contraction is a positive wave. So a positive wave going down through the heart. These are positive electrodes. So when you have a positive wave going towards a positive electrode, it creates a positive deflection on the EKG screen. So you see that V4, V5, and V6 are positive waves. And again, that's because with the heart sitting this way and the positive wave that the contraction produces, it's going towards the positive electrodes of V4, V5, V6. Now on V1 and V2, that positive wave is going away from these 2 positive electrodes. And because that positive wave is going away from them, we see more of a negative wave, meaning that they're below the baseline. Now on Jake with V3, and it could be our placement of our electrode, but you see that it is mostly down as well. And a lot of clients, what you'll see is that this one is biphasic, meaning it's equally above and below the baseline, just as much as above the baseline as below the baseline. It's not the case with Jake, but that happens sometimes and other times it doesn't. So just remember that a positive wave going towards a positive electrode is going to create a positive deflection on the screen. A positive wave going away from a positive electrode will create a downward or a negative deflection. All right, what we're going to demonstrate now is what happens when you have a patient that's really tense or really tightening up their muscles. And I'm going to have Jake really squeeze all of his muscles right now, and we'll see what's going to happen on the screen. Right now you see a normal sinus rhythm. Everything looks good, but he's going to go ahead and tighten everything up. and you can see how much artifact we have. This is exactly what we mean by artifact. This is a lot of noise in the EKG, and it makes it difficult to interpret. What happens when you have artifact is it can confuse the clinician to determine whether this is a positive test or just a false positive test. So we always want to make sure our client is relaxed. The next thing that we're going to demonstrate is hyperventilation. Now, what I'm going to have Jake do is breathe real heavy for about 30 seconds, and we're going to see what changes occur on the EKG screen. So go ahead and start, Jake. Okay, you can see on the EKG screen that we're starting to see some ST segment depression, and we're starting to see some vibrations through there for artifact. I'm going to let Jake stop so he doesn't pass out right now. But what the clinician will have them do that for is to see if we can rule out a false positive test. That hyperventilation is simulating the same thing that the client would experience when they're doing intense exercise, the breathing pattern that they would experience then. So if we see that this is just what happens with Jake when he breathes heavy on the EKG, then we can rule it out that that's really not a positive test. That really, in fact, it is just Jake's normal breathing pattern and what happens with his heart when he's breathing heavy. Most clinicians will do this after the clinical exercise test is done. If something looks like it's positive, they may ask their client to go ahead and breathe for 30 seconds real deep so they can look at the changes and compare them to what they saw during the exercise stress test. If they see the patterns are similar, then they'll probably call it a false positive test or ask for further testing to be done.